barbiturate poisoning is an important question. It can come in the final prof exam as well as MD medicine exam, and it is also part of toxicology, so it can come in NEET PG exam also. I will be talking about the mechanism of action, classification, symptoms, DD, management, and MCQs. So whenever you have to write an answer, we have to start with the etiology. So in the case of barbiturate overdose, so whenever you have to start an answer, you have to write the etiology first. In the case of barbiturate overdose, since one tablet of phenobarbital is 60 mg, so for overdose he needs to take 100 tablets. So nobody can take 100 tablets by accident. So it is suicidal. So what is pseudo-suicide? In the case of barbiturate poisoning, there is something known as drug automatism. What is drug automatism? A patient takes tablet of barbiturate. After that, he forgets that he has taken. Then he takes one more tablet. He forgets, takes one more tablet. So although he does not have any intention of doing suicide, but due to this automatism, he commits a. Due to this automatism, there is a toxicity and there is poisoning. So that is known as barbiturate automatism. Is so GABA molecule will come and bind to the GABA receptor in the neuron. When GABA attaches to GABA A receptor, there is opening of chloride channels and the neuron will become hyperpolarized and it will not be able to deliver any impulses. So there is sedation. What will a barbiturate tablet do? Barbiturate will go and what will a barbiturate tablet do? Barbiturate will go. It will attach to a barbiturate receptor. Barbiturate receptor is just next to the GABA receptor. So when barbiturate will bind to barbiturate receptor, there is increased duration of opening of the chloride channel and the cell will become more hyperpolarized. So you have to note that there is increase in duration, not frequency, because benzodiazepine also acts by similar mechanism, but the duration is not increased. There is increase in the frequency of the chloride channel. So since I have explained about GABA and GABA receptor, we can now know how the antidote will act. So if you have to give an antidote, it has to block GABA and GABA receptor binding. So what is the name of that antidote? It is bemigrid and picrotoxin. These are GABA receptor antagonists. Also, since they are antagonizing the action of GABA, they can also be known as CNS stimulants. But they are not used anymore because they had a lot of toxic action. So it is only of historical importance, but it is asked in NEET exam. That is why I mentioned it here. Okay. So talking about the duration of action, only drug of importance in clinical practice and that is important today is phenobarbital. Although barbiturates are not used anymore and I have never seen a case of barbiturate poisoning, still if there is a case of poisoning, it will mostly be because of this drug. Phenobarbital is used for epilepsy and it is a long-acting drug. Why it is long-acting? It is long-acting because it is not phenobarbital is the only drug of importance today. It is long-acting. It is long-acting because it is not soluble in lipid. If it is not soluble in lipid, it means it is soluble in water. Since it is soluble in water, it means it can be excreted in urine. And how do we do that? By alkalinizing the urine. So, few points: short-acting barbiturate, pentobarbital never used. Ultra-short-acting barbiturate, thiabenton, used sometimes in anesthesia. Okay, these two drugs they are not so much soluble in water, so they cannot be removed from the urine. Talking about the symptoms, so we can divide it into CNS, CVS, respiratory, skin and kidneys. CNS में we have already seen that there is CNS depression, so there will be lethargy, nystagmus, ataxia, coma. You can go on writing about it. Coma is the last stage. Okay, in the initial stages, pupils will be constricted, reacting to light. But when there is coma or there is brain death, then pupils will become dilated. So this is the peculiar thing about barbiturates. If you see the benzodiazepine, there will be only meiosis. Okay, if you see the organophosphorus, there will be only meiosis. But here there is both meiosis and mydriasis. CVS में there will be action on the vasomotor center, so there will be hypotension. Respiratory center will be affected. There will be apnea and hypopnea. Okay, skin में you will see something known as barbiturate blisters. This is very commonly asked in NEET exam. I'll show you a picture. This is this is an image of blister, which is formed on the surface that is touching the. It is formed on the skin, which touches the surface like the elbows and the shin. Okay. Kidney में what will happen in the kidney, since there is hypertension will lead to oliguria. ठीक है. Oliguria, there will be AKI. Oliguria is basically AKI. So for some reason they keep asking this question: what is liquid gold urine appearance? Because there's oliguria, there is dehydration, urine is very concentrated, so it appears very yellowish, and sometimes it is known as, and I mean I have never used this term before, but it is asked like that: what is the liquid gold urine appearance? That is seen in barbiturate poisoning. So what can be the other DDs for this symptom constellation? So there is CNS depression, there is depression of respiratory system. So alcohol will have same symptoms, alcohol overdose will have same symptoms, hypoglycemia there will be same symptoms, and benzodiazepine. So these three are the most common DDs to be kept in mind during this. So what will be order for investigation? One will be RBS, true route hypoglycemia, urine for toxicology. Through this we can see both benzodiazepine and barbiturates we can find out from the urine report. So if you have to add one more investigation, what will be that? It will be ECG. Okay. So what can you get in ECG? Okay. I forgot to add one symptom in this is temperature regulation. In temperature regulation, there is loss of regulation, so there will be hypothermia. Okay. Since there is hypothermia, what will you get in ECG? Osborne wave will be seen. If temperature drops to less than 30 degree core temperature, then patient can have VFib. Okay, so you can add that in investigation. Okay. Talking about management, whenever you have to write answer and you have to write about management, you have to start with supportive treatment. So patient is comatose, he is not breathing. What will you do first? You will first intubate the patient. You will intubate the patient. You can secure the airway. If he does not need intubation, you will simply give him oxygen. And lastly, it should not be last, it should be done simultaneously. But what will be circulation? You will put 2 wide bore cannulas and you will rush fluids because patient is having hypotension. Okay, he is in shock, he is having oliguria, he is having that liquid gold urine. So you rush fluids using 2 cannulas. After this, now you have to decontaminate the patient. You have to remove the drug. So you put an RT tube, you do lavage. If patient has come in less than 1 hour, there is a role of activated charcoal. Charcoal has very good binding to barbiturate. Okay, so but there is one risk: charcoal can easily get aspirated. So if you are giving charcoal, make sure there is a rise tube intact, or you have put an ET tube. Matlab patient is intubated. Only then you have to give the charcoal. If patient is not in the 1 hour window period, what can we do next? So we have to remove the drug from the body. We can do it. I had talked about it earlier. We can remove it through the kidneys. Okay, barbiturate is an acid. If you have to remove acid, we have to add alkali. So what is the alkali we are going to add? We will add sodium bicarbonate. Dose is 1 milliequivalent per kg bolus. After that, we have to start an infusion. Infusion is 100 milliequivalent sodium bicarbonate in 1 liter of D5. Okay. 100 milli equivalents of sodium bicarbonate in 1 liter D5. Okay, so if you remember from the basics, you know that acidosis causes hyperkalemia. Sodium bicarbonate is an alkali. Alkali base causes hypokalemia. So there is a risk of hypokalemia. So in the investigation part, you can add one more investigation is potassium monitoring. Okay, next, how will we remove the drug further? There is an extracorporeal method. Extracorporeal means from outside the body. So you can use hemodialysis and hemoperfusion. Barbiturate is a dialysable drug. So in hemodialysis, we are removing the blood from the body, putting it in a dialysis machine. Machine is removing the drug, and we are sending the blood back to the body. And what is hemoperfusion? Hemoperfusion is we are removing the blood from the body. We are putting it in the membrane. Membrane has charcoal. Charcoal will absorb the drug, and then we are sending the blood back to the body. So hemodialysis, hemoperfusion, and urine alkalization and GI decontamination. These are the only ways to treat a case of barbiturate poisoning. There is no antidote. Okay, 2 antidotes we had talked about earlier: picrotoxin and bemogride. They are not used anymore. They are CNS stimulants. They were antidotes, but it was in the past. It can be asked in NEET PG, but it is not used now. Okay. Okay, now that we have discussed everything, I don't think there is anything left in barbiturates, so we can solve some questions. Okay, pyrexia. Okay, I had said that there is temperature regulation, there is a problem in that, there is hypothermia, but sometimes patient can have pyrexia also. Okay, pupils are constricted. What does this mean? It means patient has come in an early stage. In the last phase, when the patient has coma, the pupils will get dilated. Okay, there is hypotension, cyanosis because of respiratory issue. After that, so the poisoning is due to, answer is phenobarbital. Urine has liquid gold appearance, barbiturates. Stupid question. Barbiturate excretion in urine can be increased by alkalization. Okay, automatism, keep on taking the drug, forgetting that he has taken the drug, take the drug again. It is seen in barbiturates. All of the following are features of barbiturate poisoning abstract. So there is difficulty in breathing, yes. There is meiosis, yes. There is skin involvement, yes. But there is no hypertension. There is hypotension, shock, oliguria. Okay, which of the following is ultra short acting barbiturate? Okay, so I had said phenobarbital is the only drug that we used now. Phenobarbital is the only drug that we use now. It is a long-acting drug. What about thiapenton? What about pentobarbital? Okay, pentobarbital is not used anywhere. It is short-acting drug. Thiapenton is a ultra short-acting drug. Ultra short-acting drug, it is used in anesthesia. So that's all for barbiturate poisoning. Thank you.